Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. I want to go into giving you an overview of oncology. So, a lot of this is the basics of cancer. Oncology is the study of cancer. Now, cancer isn't just one cancer, it's actually a group of hundreds of diseases with the main component that there is a genetic change in the cell. So, wherever there is a change in the cell in the body, that's essentially the beginning of cancer. Because what happens is that the cell starts to grow uncontrollably, and that can form a tumor. Now, it's not only tumors, because we also have cancers of the blood and of the lymph, which are, the other forms of cancer. So, what are the different kinds of cancer? So, let's touch on that. So, carcinoma, it's the one where it begins in the skin or it begins in the tissues of the internal organs. So that's where breast cancer, prostate cancer, lung, colorectal, etc. So the ones that begin in the organs, those are carcinoma. Okay, the ones that are sarcoma is muscle or connective tissue. So sarcomas would be cancers of the muscles, of the fat, of the nerves, tendons, those kind of things go under sarcoma. And then leukemia is the ones that are cancers of the blood, and lymphoma is cancer of the lymph system. Whatever the name of your cancer is, hopefully now you know how that name is derived. Now, you might have heard the word metastatic. Is my cancer spread? Is it metastatic? Metastatic means that the cancer cells have been growing and they've been developing new tumors. So, metastasis means that the cell is traveling to another part of the body. That's metastatic. Now, there are many different ways that cancer is diagnosed based on the kind of cancer that is suspected. There are different tests that are done. Biopsy is the most common. And then there are several screening tests that we do regularly to identify if there is a risk of cancer, because colon cancer, breast cancer, prostate cancer, those are some of the most common cancers, skin cancers. That's why these screening tests are part of our preventative tests and services in most health plans and part of recommendations. I won't go too detail into the different screening tests. You can search and read up on that online for your particular cancer if that's of interest to you. Now, something you might have heard is the stage of cancer, right? You might have heard or seen in the report that they have written what is the staging, TNM, right? So let's demystify that. It's actually quite straightforward. So T stands for tumor. So, what is the size and location of your primary tumor? N stands for the node. So, has the tumor spread to the lymph node? So lymph node is circulating, it's like little clusters. Through that, there is a risk of circulating the cancer to other parts of the body. So that's where N stands for the node, whether the tumor has spread to the lymph nodes. And M stands for metastatic, which we learned, has the cancer spread to different parts of the body. So that's TNM staging model. Okay. The other way that staging is typically done is to say whether you're stage 0, 1, 2, 3, or 4. So here, 0 means that it's local, a particular area, it's very, very small. Stage 1 means it's just started, it's early stage, it's local in that particular area. For example, if it's breast cancer, it's just on the, let's say it's in the left breast. Okay. Stage 2 and stage 3 means that it has started to occupy bigger area, or it has spread to, let's say, from left breast, it's also spread to the right breast, or it's spread to that chest cavity area. Stage 4 would mean that the cancer has spread to other parts of the body. So let's say it's gone from my breast tissue to my lungs, or it's gone to stomach or to some other part of the body. So that would be metastatic. That's stage 4. So it's spread to other parts of the body. So hopefully this gives you a sense of understanding what your cancer staging means. Based on this type of stage and the cancer and many other factors, we have several protocols that help us to determine what kind of treatments we can offer. So that's where your oncology team would be working on determining what's the best way to tackle this cancer, what kind of treatment we're going to give. Is it going to be multiple treatments? Typically, it can be surgery and chemotherapy, or surgery and radiation, or chemotherapy and radiation, or hormone therapy. So that's where the treatment plan gets determined based on the cancer, on the stage, and based on many other factors. We will touch on some of these main ones as we go through this. So we're going to be touching on chemotherapy, radiation, surgery, hormone, targeted immunotherapy. Palliative care also is something we're going to touch on. All right. Active surveillance means that we are going to wait and watch how this cancer is progressing, and based on that, determining whether we need to treat it. Of course, knowing about this is important for your health, and to know why you're being given certain treatment and why this treatment could be effective for it. You can always go online and search on credible websites about your treatment and about your cancer. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.